like it's soft. The soft palate is there, actually it sort of flips up when you swallow so that food and water don't go up in your nasal cavity, at least ideally. And at the very tip of that, there's the structure of the uvula, okay? The uvula you're probably familiar with. If you look down somebody's throat, okay, now there's that little thing hanging down in the middle, that's the uvula, okay? All right. You wouldn't want to go through an anatomy class and not know that. Okay, so this, okay, is the pharynx, the throat, okay? It's fairly large, so it's divided into three portions, okay? There's a nasopharynx behind the nose, there's an oropharynx behind the mouth, there's a laryngopharynx behind the larynx, okay? The boundaries, more specifically for these, okay, is that the nasopharynx is superior to the palate, okay? And between the palate and the base of the tongue, that's the oropharynx. And inferior to the base of the tongue, that's the laryngopharynx. Okay? So, they're in the logical places, but might be nice to have some borders. Okay. Let's look at the larynx first like this, and then we'll look at it on the model. Okay? Okay, so here's the larynx. Okay, it's an unusual organ in that it's mostly made out of cartilage. Okay, that's what this sort of funny light blue stuff is supposed to be. That's the key for it. This cartilage right here is the thyroid cartilage. It's this right here.
It's hyaline cartilage, right?
It's hyaline cartilage, exactly. Yeah. Okay, this is the little anterior portion of the cricoid. Okay, you can't see it here, but the cricoid kind of wraps around the back. Okay, so pretty much the anterior cartilage is the thyroid, a little bit of the cricoid here, but it's mostly posterior. Okay. All right, the other thing, if you look through here, okay, so there's a little passageway down the center. Okay. That passageway is the glottis. Okay, in the same way that, you know, the pupil of the eye is really a hole in the iris, okay, this is the glottis. Okay, so if this is the glottis, okay, then this is the epiglottis, the upon the glottis. Okay, this is what closes the glottis off. Okay, when you swallow, you probably have saw this illustrated already. Okay, your thyroid cartilage kind of bounces up. What's actually happening is that the larynx is moving up against the epiglottis to seal itself off. Okay. Also, inside there, there's two muscular bands, okay, here and here. Okay. The superior one is called the false vocal cord. The inferior one is called the true vocal cord. The false vocal cord is called the false vocal cord because it doesn't make sounds. Okay. What it does instead, it really backs up the epiglottis. It's there also to try to keep food and water and so forth from going down the lungs. Okay? The false one is on top. Okay? Makes sense, right? It's closer to the exit. Okay? That's where you would find it. Okay? And the true one is inferior to it. The true one is the one that's responsible for the tones in speech. Okay? Things like if you say, "Did he really do it?" and your voice kind of goes up at the end, all that pitch is coming out of these chords like that. Okay? So yeah, you use it when you when you sing or something like that, but actually in your speech all the time your pitch is constantly rising and falling for emphasis and so forth. Okay? All right, so, and then what else? So,